So, coming on to the next most common anal canal pathology that we encounter in adults is an anal fissure. Now, anal fissures are unique in the fact that they occur not only in adults, they occur even in newborns and infants. In fact, one of the most common causes of bleeding per rectum in the neonatal and the infantile period is an anal fissure. Similar to an older individual or an adult, even children or even infants, to be more specific, can develop anal fissures. So what exactly is an anal fissure? So an anal fissure is a linear ulcer. So it's vertical, usually in the midline. It is distal or below the level of the dentate line, which is very important, which kind of is the reason why anal fissures are so painful, because they involve the anoderm. So it is distal below the level of the dentate line. It can be anterior, it can be posterior, or it can be lateral. Most commonly, it is posterior. The reason why it is posterior is because there are many reasons attributed to it. One is that the shearing forces of defecation seems to be the most on the posterior wall. The anoderm on the posterior aspect seems to be less elastic with a lot of longitudinal muscle fiber extensions. Basically, it is more adherent. Third point, which is said to be the reason for the formation of fissures on the posterior aspect more commonly, is that the posterior anoderm, particularly in the midline, seems to have a reduced vascularity compared to the rest of the anal canal. So three causes. One would be presence of shearing forces at the level of the posterior aspect. Second is that it is less elastic with more extensions into the longitudinal muscle fibers. So basically it is more adherent. Third is that the blood supply, the posterior aspect midline, the blood supply seems to be precariously low compared to the rest of the anal canal. So these reasons seem to attribute to the occurrence of a anal fissure on the posterior aspect most commonly. It can occur anteriorly, but anterior fissures are very common in females, particularly post-delivery or postpartum. Okay. Lateral fissures. Now, lateral fissures, if they are present, you should always suspect the presence of associated inflammatory diseases or other causes. For example, it can be Crohn's. Okay. Features of Crohn's can lead on to anal fissures. Sometimes immunodeficiency disorders and secondary infections can result in lateral fissures. So, always suspect presence of a comorbidity in a patient with a lateral fissure. So, lateral fissure has to be investigated further. Now, commonly a fissure will have two important findings. One would be the presence of an external sentinel skin tag. So, the skin tag is external. So, it has a counterpart on the inner aspect or internal aspect, which is called as a hypertrophied anal papilla. So, why does a skin tag or an anal papilla occur? It is because of this constant process of healing and then breakdown. So, there is an active fissure, a wound or an ulcer, which heals, then breaks down again, forms an ulcer, heals, breaks down, heals, breaks down. So, this results in the formation of these papilla, anal papilla on the internal aspect and a sentinel skin tag on the external aspect.